US is the leading country in the field of biochemical research. However, it is also the country with the most infection cases and deaths when facing COVID-19. What caused this situation? After the COVID-19 outbreak in January 2020, the Chinese government locked down Wuhan, a megacity with a population of 10 million, and enacted mandatory quarantine on the residents to control the spread of the virus. During this period, the US had more than enough time to prepare for the spreading of COVID-19, but the window was wasted. Why did the US government underestimate COVID-19 that much?
Well, not at all, and we have it totally under control. It's one person coming in from China. A week ago, I hadn't seen him in a long time, and I said, "How you doing?" He said, "Fine, fine." He hugs me, kisses me. I said, "Are you well?" He says, "No." He said, "I have the worst fever and the worst flu," and he's hugging and kissing me. So I said, "Excuse me." I went and I started washing my hands.
And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job. Get easy, just relax. That's really bad reporting. All these empty, these in-between chairs. Yeah, no, I don't take responsibility at all. I think we've done a great job.
The answer is, the US and its European allies had an unspoken consensus. They thought the virus would only attack immune systems of Asian races. In February 2020, Italy stated to Japan that COVID-19 is an Asian disease during the third finance ministers and central bank governors meeting held in Riyadh, Saudi Arabia, in which Taro Aso, the deputy prime minister of Japan, participated. Based on this kind of opinions, it is not difficult to explain why Trump and the US governors were indifferent to COVID-19. But here comes the question. What sources of information convinced them to make such a fatal judgment? Was the irreversible global spread of COVID-19 caused by viral mutations? Trump banned the entry of Chinese travelers to the US as early as on February 2nd. But when it came to March 8th, COVID-19 still began to spread among communities in New York. The US did not announce restrictions on entries from European countries until March 13th. The spread of COVID-19 gradually got out of control in the US, and the number of deaths increased rapidly. The president and governors of the US started to name the COVID-19 as a Chinese virus with the intention of converting the fight between humans and the virus to conflict between the US and China. Consequently, numerous racist incidents against the Asians took place in the US society.
Politicians make US-China relations a campaign issue, and as the death from COVID-19 mount, I think the anger and the fear is only going to increase.
My big fear is when lockdown ends, these cases are going to surge because there's so many just even when no one's going out. What's it going to be like when everyone goes back out?
Until July 17th, the US CDC finally disclosed in a report that the virus strain spreading in New York was completely unrelated to the one in Wuhan, China. At the present days, COVID-19 is not merely targeting Asians anymore. Anthony Fauci, the chief expert of infectious diseases in the US, pointed out that the virus is more threatening to people with African origins because they have higher ratios of underlying diseases such as diabetes, hypertension, obesity, and asthma. Data from New York's Department of Public Health indicated that the gap between the rich and the poor resulted in much higher infection and death rates among African Americans, Latinos, and Hispanics than those among Caucasians and Asians. The disparity of death rates among living districts reached as high as a 15-fold difference. During the spread of COVID-19, the US government continuously made unreasonable coping strategies, and the health and lives of citizens were devoured endlessly by this vortex. What is the truth behind all of it?